Therefore, we are stewards of our physical health. Health is a precious gift from above. Without a doubt, the greatest wealth is health.
Diabetes is a fast-growing disease. In the latest statistics from the World Health Organization, there are roughly 422 million people affected with this disease globally.
In Canada, an estimated 2.1 million people, aged 12 years old and older, are living with diabetes.
And it is projected that by 2030, the number of people with diabetes will rise to 439 million.
The youth of today are not spared from this disease. There are 15,876 diagnosed cases of diabetes in age group 12 to 19.
Diabetes is also 3 to 5 times higher in Aboriginals than the general population. 20% of the Aboriginal population in Canada have diabetes.
Globally, an estimated 1.6 million deaths were caused by diabetes, and an additional 2.2 million deaths listed diabetes as a contributing factor.
The culprit for 1 in 10 deaths in Canadian adults is diabetes.
Diabetes is the 6th leading cause of death in Canada.
These numbers are quite alarming. Thus, education about this topic would prove beneficial to the population at risk, to the general public who wants to gain insights regarding the disease, and for those people who are concerned for the health of their loved ones.
So, what is diabetes? Diabetes is a disease wherein the person has an elevated sugar in the blood because the body cannot adequately produce insulin, or the body cells do not respond properly to insulin.
What is blood sugar? Blood sugar comes from the food we eat. The body converts the food we eat into blood sugar.
What is insulin? Insulin is like a key to the body's cells. It unlocks the door to the cells, so sugar can enter the cell and be used for energy by the body.
In diabetes, sugar in the bloodstream cannot enter into the body's cells because of insulin deficiency, or the body's cell is not responding to the insulin. We call it insulin resistance.
What is the cause of insulin deficiency? The pancreas is responsible for the production of insulin. Therefore, damage of the pancreas results in insulin deficiency. There are also a number of research supporting obesity as a cause of insulin resistance.
Now we will examine the risk factors associated with diabetes, family history of diabetes, disease of the pancreas, gestational diabetes, prediabetes, hypertension, elevated cholesterol, age and sex, ethnicity, educational attainment, sedentary lifestyle, and dietary factors.
Although some of the factors are non-modifiable, the good news is many of these risk factors can be altered through lifestyle changes. Knowing your risk will help you to make healthy choices and reduce your risk, or even prevent yourself from developing diabetes.
Now that we are aware of the risk factors, we will perform a focused risk assessment for diabetes using the CANRIS questionnaire developed by the Public Health Agency of Canada.
What is the importance of conducting this assessment? Disease prevention, health promotion, and early detection is the main focus. Why we need to conduct this type of health assessment? Through a number of questions regarding risk for diabetes, we can calculate the probability of developing diabetes. This is a great assessment tool to use, since it is simple, validated, inexpensive, and non-invasive. Also, this assessment tool can be utilized not only by healthcare providers, but can be self-administered due to its simplicity.
Now take a paper and a pen, and together, we will calculate your risk for getting the disease. As you get older, your risk of taking the disease goes up. Lean body mass and increase in abdominal fat accompany aging. This contributes to insulin resistance. Select your age group and note the corresponding points. 40 to 44 years old is 0 points. 45 to 54 years old is 7 points. 55 to 64 years old is 13 points. 65 to 74 years old is 15 points.
Are you a male or female? Male are more susceptible to the distribution in body fat. Men tend to store more fat in the abdomen. If you are a male, add 6 points. If you are a female, you get 0 points.
What is your body mass index? Use this chart as a guide to take your BMI. You will also need your height and weight for this. BMI less than 0 to 24 is 0 points. 25 to 29 is 4 points. 30 to 34 is 9 points. And 35 and above is 14 points. Body mass index is an indicator for obesity. As we have learned, obesity is one cause of insulin resistance.
Next, measure your waist circumference at the level of your belly button. As we have learned, abdominal fat predisposes you more to the disease. For men, 0 to 36 inches is 0 points. 37 to 40 inches is 4 points. And 41 inches and above is 6 points. For women, 0 to 31.4 inches is 0 points. 31.5 to 35 inches is 4 points. And 35.1 inches and above is 6 points. Sedentary lifestyle is associated with increased insulin resistance. Do you usually do some physical activity, such as brisk walking for 30 minutes each day? If yes, you score 0 points. If no, you get 1 point.
Fruits and vegetables contains antioxidant properties. Antioxidants has reportedly improved insulin sensitivity. How often do you eat fruits and vegetables? If every day, you score 0 points. If not every day, you get 2 points.
Having high blood pressure raises your risk of having diabetes. Diabetes and high blood pressure are often found together. Have you ever been told that you have a high blood pressure? Or are you taking blood pressure pills? If yes, you get 4 points. If no, or you don't know, you get 0 points.
History of high blood sugar may be a warning sign that you are at high risk of developing full-blown diabetes in the future. Have you been ever found to have high blood sugar, either from a blood test, illness, or pregnancy? If yes, you score 14 points. If no, or you don't know, you get 0 points.
Giving birth to a large infant over 9 pounds is related to high maternal weight gain during pregnancy and/or gestational diabetes. Have you ever given birth to a large baby weighing 9 pounds or more? If yes, you score 1 point. If no, or you don't know, you get 0 points.
Families not only share genes, which influence diabetes risk, but also shared culture and lifestyle. Example, eating together at the same table. Have any of your blood relatives ever been diagnosed with diabetes? Check all that apply and tally the points. Mother equals 2 points. Father equals 2 points. Brothers and sisters equals 2 points. Children equals 2 points. Others equals 0 points.
Certain ethnocultural groups are at higher risk of developing diabetes. Check which of the following ethnic groups your blood parents belong to. If your father or mother is white is 0 points. Aboriginal 3 points. Black 5 points. East Asian 10 points. South Asian 11 points. Others non-white such as Latin American, Arab, West Asian 3 points. Choose only one score, the highest score. Do not add mother plus father scores together.
According to studies, lower education levels have less access to medical care, lower levels of physical activity, higher levels of smoking, poorer diets, greater prevalence of hypertension and diabetes, and fewer economic resources. What is the highest level of education that you have completed? Some high school or less 5 points. High school diploma 1 point. Some college or university 0 points. University or college degree 0 points.
Now add up your points from all the questions, and we shall check your result based on your identified risk. For scores 0 to 20, your risk of having pre-diabetes or type 2 diabetes is fairly low, but it always pays to maintain. a healthy lifestyle, for scores 21 to 32, your risk of having pre-diabetes or type 2 diabetes is moderate. You may wish to consult with a healthcare practitioner about your risk of developing diabetes, and for scores 33 and over, your risk of having pre-diabetes or type 2 diabetes is very high. Consult with a healthcare practitioner to discuss getting your blood sugar tested.
Now that we have conducted the first part of the assessment, and you are now geared with the knowledge of your risk level, we will discuss the signs and symptoms of diabetes. And also I will teach you how to do physical assessment.
So, what are the warning signs of diabetes? What are the first clues we need to be aware of?
Because blood sugar cannot enter the cells, the level rises in the bloodstream, and the body tries to get rid of the sugar through the kidneys. So, people with undiagnosed or untreated diabetes have frequent urination.
Because of frequent urination, you will get very thirsty. The more you pee, the thirstier you feel. Thus, another warning sign is frequent thirst.
And because sugar is passed in the urine, it makes a good medium for bacteria to grow. So, it is common to get thrush or genital itching.
Our body's cells need energy from sugar. Because glucose remains in the bloodstream and cannot enter the cells, people with undiagnosed diabetes is often tired and lethargic.
Since the body cannot get energy from sugar, it starts to break down its fat stores, which in turn will cause weight loss.
Also, when blood sugar cannot enter the cells, the food you eat cannot be converted into energy. Lack of energy causes an increase in hunger.
Elevated sugar in the blood also causes poor blood circulation, making it hard for skin to repair. This causes wounds to heal slowly.
Prolonged high blood sugar can damage delicate nerves. You will feel numbness, tingling, or burning sensation of the feet and lower legs.
Blood sugar can also build up in the lens of the eye. Undiagnosed people will experience blurred vision.
Because of frequent urination, you will lose fluid at a faster rate. This could contribute to dry, itchy skin.
Excess sugar in the blood causes changes in the skin. Dark, thickened and velvety skin can be found at the back of your neck, armpits, under the breasts, groins and knuckles. The medical term for this is acanthosis nigricans.
Now let us test your memory. What are the 11 warning signs of diabetes?
Now that you are familiar with what to look for as part of the data collection, I will ask you a series of questions which is very important. In order to ascertain your risk of getting the disease, establish whether you need medical care and plan health-promoting activities, we need to gather subjective data and combine it with objective data from your physical assessment to get a clear picture of your risk level for diabetes. Since most of the questions for patient history have already been asked in the Canvas questionnaire, I will not repeat those here. Let us begin. Have you noticed a change in your mood and memory? Blood sugar swings as well as dehydration from frequent urination can cause confusion, anxiety and depression.
Do you have wounds that heal slowly? Slow healing wounds are linked with diabetes. Do you have chronic itchy skin? This could be caused by dehydration and poor circulation from diabetes.
Do you have difficulty seeing or any blurring of vision? High blood sugar make the lens cloudy and damage the retina.
Have you unintentionally lost weight? Weight loss may result from uncontrolled diabetes and dehydration from frequent urination. Any changes in your bowel movement? Diarrhea or constipation may be caused by nerve damage in the intestines. Are you awakened by the need to urinate at night? Have you noticed excessive hunger, thirst and urination? These are hallmarks of diabetes. Have you noticed any unusual vaginal discharge? Is the discharge associated with itching and rash? Sugar present in the urine is a good medium for bacteria to grow. Do you have any concerns regarding sexual activity? Difficulty with erection, sexual decline, and satisfaction could be related to fatigue and damage of the nerves and blood vessels that accompany diabetes.
Do you have pain, numbness, tingling, or a burning sensation in your feet, legs, and hands? This can be caused by nerve damage from diabetes. Do you often experience headache and dizziness? You may experience this if your brain lacks sugar for energy. Do you have trouble sleeping? Have you been told that you snore? Are you sleepy during the day? Lethargy is a warning sign of diabetes. Do you always feel tired and exhausted even if you are doing nothing? With diabetes, your body cannot convert the food you eat into energy.
How would you rate your general health? If your answer is poor or unsatisfactory, then you may want to consult your family physician. A health problem that needs attention could be lurking.
Now, let us conduct a focused diabetes physical assessment to identify signs, which could be a medical concern. In the CAN risk assessment, you have already measured the following: height, weight, waist circumference, and BMI, all of which are important to determine obesity, which increases your chances of developing diabetes, or weight loss, which is a sign of fat embolism.
Next, if an automatic blood pressure is available in your home, check your blood pressure and pulse. If you have exercised, took caffeine, alcohol, or tobacco products, wait 30 minutes before checking blood pressure. Sit in a chair with both feet flat on the ground and back straight. Place your arm at the level of your heart. Wrap the cuff around your bare arms with bottom edge 1 inch above the elbow crease. And tubings in the center. It should be snug with room for 1 fingertip under the cuff. Now, press start and stay still until reading is complete. A normal blood pressure is 90 to 120, over 60 to 90 mmHg. A normal pulse rate is between 60 to 100 beats per minute. If your reading is outside of this range, consult a doctor. Hypertension places you at a greater risk of developing diabetes.
To assess the skin, have a good lighting source, take off your clothes, stand in front of the mirror and survey all areas of your skin. Examine the front part first, starting with your face, neck, chest, arms and legs, and inspect your back using another mirror. Take note of the following: extremely dry skin, which could be due to dehydration, redness especially on lower legs, which could be from nerve damage, rash especially on groins because of presence of sugar in the urine, stretch marks, dark patch of velvety skin at the back of your neck, axilla, under your breasts, groins, knees and knuckles, which indicates obesity. Wounds present for several weeks due to poor blood circulation.
Test your vision. Read a newspaper about 14 inches away from your eyes. Ensure that you can read adequately.
A peaceful heart leads to a healthy body.
A common complication of diabetes is vision impairment like cataract. Examine your eyes for redness and cloud formation in the lens, which is caused by high blood sugar and diabetes.
Inspect your oral cavity. Use your index finger to retract your lips and sides of your mouth. Sores, swollen gums, dry mouth, cavities and white patches on the tongue and throat is possibly caused by poor immune response due to diabetes.
Check the color and odor of your urine. Dark yellow urine indicates dehydration. Sweet or fruity smelling urine may be due to spilling of sugar in urine and are a product of fat metabolism. Inspect skin of arms and legs. Pay attention to soles of feet and web spaces.
Ulcers, infection, slow healing wounds indicate poor circulation.
Check the temperature of your legs with the back of your hand. Cold, clammy skin indicates poor blood circulation. Check toenails for color and thickness. Discolored and thickened nails are signs of poor blood circulation. Check for absence of hair on the legs. Hair loss could indicate poor blood circulation.
Check the muscles of your legs and arms. A decrease in size or atrophy may be caused by nerve damage or fat metabolism. Check capillary refill. Press the soft pad of the toe until it turns white. Release and take note the time needed for the color to return. More than 2 seconds indicate poor blood circulation. Check skin turgor. Pinch the skin at the back of your hand. Release and observe how fast it returns to its flat position.
Longer than 3 seconds indicates dehydration.
Tap the inner middle portion of your wrist. Burning or tingling sensation on the fingers is a sign of nerve damage. Next, flex your wrist by placing the back of your hands together. Remain in this position for 1 minute. Pain along the wrist and hands indicate nerve damage. If you are able to, locate the following pulses and note its strength. Dorsalis pedis. Place fingers just lateral to the extensor tendon of the big toe. Posterior tibial. Place fingers behind and slightly below the medial malleolus of the ankle. Weak pulse indicates poor circulation. Test sensory function. Ask someone for assistance. Close your eyes and let the person touch the cotton and needle on various areas of your legs, including the soles. Identify whether what touched you was the cotton or needle, and point the exact location where the item touched. Decreased sensitivity or sensory loss indicates nerve damage.
Cotton. Needle. Cotton. Needle. Cotton. Needle. Cotton. Needle. Cotton.
Now, just a few questions to see how much you have remembered.
What is insulin? What is the cause of elevated blood sugar in the bloodstream? Why do people with elevated blood sugar feel tired and lethargic?
True or false? It is not important to inspect the soles of the feet.
A 160/100 mmHg blood pressure is normal.
Frequent thirst is a symptom of diabetes.
Diabetes slows wound healing.
Obesity increases your chances of having diabetes.
Elevated blood sugar gives you more energy.
Diabetes is a debilitating and sometimes fatal disease. But you don't have to go this road. Keep track of your health. T. Trim your tummy fat and maintain a healthy weight. R. Resort to a healthy diet. A. Add more physical activity. C. Control your blood pressure and cholesterol level. K. Kick the drinking and smoking habit.
Awareness is vital.
Prevention is key.
1 Corinthians 10:31. So whether you eat or drink or whatever you do it all for the glory of God.